Welcome back on the AM show. I remember those commercials from back then, the A, B, C, and all of that. I don't know how many of you remember, abstinence, be faithful, condom use, and all of that. At a point, it just fizzled out. And now, guess what stark reality we are faced with? AIDS, HIV, and AIDS are on the rise again. And guess what? Even more staggering, a number of people are not aware of their status, and they are out there. And unwittingly, they may be spreading the virus. And that is why this morning we have a conversation with the AIDS Commission to know what is going on, to get a fair idea of the self-testing, which is a very great development. And joining us in the studio, Ernest Otson, President, Ghana HIV/AIDS Network, and Samuel Dankwa, Country Manager, Abbott Infectious Diseases. Both of them join me in the studio for a conversation. Ernest, Samuel, a very good morning to you.
Very good morning.
I hope I didn't murder the Otson.
You got it excellently right.
Okay, we thank God. We thank God for that. But I would just like to start off from the standpoint of how far we've come.
Yeah.
Some of the new measures that have been put in place.
Yeah.
The Ghana AIDS Commission has been coming through from time to time, sharing with us. I'll just start from there. What's new before we even get into? I know we are itching to talk about the self-testing.
Yes.
What have we been up to so far?
Well, as a country, we have been on this campaign actively for the last 22, 23 years. And we've made some modest gains. But unfortunately, we took our eyes
off the ball.
And we are getting new cases coming up every now and then. So this has really gotten us very much alarmed, because we have a very young population that has virtually no knowledge of HIV and AIDS issues. Just like we mentioned, in the past there used to be campaigns everywhere. And so we all got to know about the ABCD, but now those...
So we're making cartoons
exactly,
and all of that,
exactly.
And it just stopped.
Yes, it just stopped some way, somehow. But now the Commission is really offering that leadership that we need and rallying civil society organizations to come together to support the national effort to bring down this disease. Because there's a global commitment that by 2030, by 2030, HIV should no longer be of a public health concern. Just like how we have been able to deal with COVID, we should be able to deal with HIV by 2030. So that is why we are all now rallying our energies towards eliminating, minimizing new infections of HIV.
I know one major problem you have.
Sure.
Funding.
Exactly.
How is that going? I know the last time Doc came here, we were talking about, we actually had an appeal here on TV.
Sure.
Corporates Ghana, individuals who have the capital, people of goodwill. How is it going? Well, and I always let you do this when you come here so that people will know that it's still an emergency. We must still tackle this, and if they can support, how they can do that.
Yes, thank you so much for that support, because we really need it. All these years, the Global Fund has been the major sponsor of our national response. Since 2002, in fact, we were the first country to receive a Global Fund grant. And that was way back in 2002. From that time to now, government has been supporting, but majorly it's been the Global Fund. They've invested more than $1 billion in our national response. We, as civil society organizations, have also been advocating that government needs to put in a lot more resources domestically, because the Global Fund will not be there forever. At some point, it's a fund. At some point, they may fold up. And at that point...
How will we sustain ourselves?
Exactly. Because as we speak, we have 252,000 Ghanaians who are HIV positive and currently on treatment. And the medications are paid for by the Global Fund. These are very...
You are talking of the ARTs.
The ARTs, yes. Very expensive. And the Global Fund has to pay for these medications. Now, if the Global Fund, for any reason, decides to, fold up, what happens to our brothers and sisters?
And this is reality.
And this is a reality.
When COVID came, some things were cut off. Because they're also thinking of themselves.
Exactly.
Ukraine, Russia happened. They are thinking of themselves.
Even the
so
vaccines.
Something else will happen.
Even the vaccines.
God forbid.
even
with the vaccines.
You saw what they call, the advanced countries were actually hoarding the vaccines for their people.
Of course, they will think of their people first.
Exactly. So that is why we need government to actually commit to supporting. So the Commission has launched a code, star 9898 hash.
Star 9898 hash.
Yes. Okay. And from any network, you can make a contribution to support the national response. And this is very important because the prevalence is around 1.7. Meaning out of every 100 Ghanaians you meet, at least 2 are HIV positive.
Wow.
Yes. And if we don't deal with the situation, for me, what is disheartening is the young children who are being born with a virus.
Yeah. Which could be avoided. It's avoidable.
Very, very much so. Very much so. If we are able to put all pregnant women on treatment and they stay on treatment, we'll be able to avoid that.
Let me briefly, I'll come right back to you. I know, Samuel, you are not going to get into the real conversations. The Ghana AIDS Commission is handling this. But from where you sit, because your outfit conducts these tests and all of that, I mean, what do you see in terms of HIV AIDS, in terms of people coming, testing? Do people come often? And when they do, I mean, can you give us just a few statistics from your area of expertise?
Okay, thank you so much. So with Abbott, we, in support with the Ghana government, we want to help, and from where we sit, to be able to eradicate this issue as we are undergoing. The focus from our perspective is that we want to support them from the testing perspective, where people can test from their homes without any stigma or any issues. So that is where we are as Abbott.
Okay. Yeah. So that is the whole point. No one gets to know that you are even testing and all of that. It is between you and basically God. And then you get in touch with the AIDS Commission. And I know you have a policy in place to ensure that you protect these people.
Oh, yes.
So that people, because word of mouth, next thing you know, I've heard of cases where you go to a certain medical facility and then someone sees you. Hey, before you get home or into your community, people are pointing fingers.
Yeah. You know, stigma is a very big issue. And from what we've seen over the years, the stigmatization and discrimination associated with the virus actually kills people, even more than the virus itself. Yeah. So we need people to accept the fact that even though we still tell people that we all need to prevent this, HIV infection, it is not as dangerous as it was some 20, 30 years ago when we had no clue as to how to deal with it. Today, there are medications that if you take, you'll be fine. In fact, there is even advancement. And in the very near future, we're going to introduce medications where you take or injections where you take just once you take twice every year. So it's not going to be a dolly days anymore. You take your injection just twice a year and you are fine. So each time I get opportunity to be in the media, one thing I always say is that we've observed many people started treatment, but they have stopped.
Yeah.
Many people. Just a few days back, I was told of someone that I know personally. She was on treatment, some way, somehow stopped because she said she had been healed and, all manner of things. And just last week, she lost her life. So we know it's not easy. It's not easy living
sometimes, it's also about the cost of travel and all of that.
Yes.
Because some people come from far away places. I know the dynamics, which is why this injection thing you are talking about could be a game changer.
Yes, in the very near future. There are trials in other countries, and we are hoping that very soon we're going to have it in Ghana so that it will ease because of stigma. That is why people don't go for treatment in facilities close to them. So people will choose to go to maybe northern region, eastern region, central, western, even though they're residents in Accra. Yeah. So I always say that when we look at the national statistics, we shouldn't even stigmatize regions to say that this region has the highest or whatever
prevalence.
Because for UK, there are people moving from their regions to other regions because of this issue of stigma. They want to avoid being seen in facilities close by their area. So we need to actually stop the stigma and accept the fact that if you look at the modes of transmission.
No, but Ernest, it's an illness just like any other illness.
Yes, yes.
It's just that this one, if not handled in a certain way, can take your life.
Exactly.
It's an illness. Even malaria.
Exactly.
If not, if you have too much of a viral load, can kill you.
Exactly.
So I don't know why sometimes we get, and it's human beings who have them. And I always cite the issue of Magic Johnson, basketball.
Yeah, yes.
Look at how long, and if you saw him and no one told you that, he had HIV.
So one of the key things to also do when you go into the media is to explain the difference between HIV and AIDS.
Yeah.
When someone has HIV, they don't show any symptoms at all.
Yeah.
No symptoms whatsoever. They are normal, they are perfect. They can go on for as long as 10 years before the signs will show, because their immunity will be so down. But if you are detected early and put on treatment, your immunity will be very strong and you'll be healthy and you'll go about your normal duties. Like I said, 252,000 people are currently on treatment and they are doing fine. And so nobody should stay at home and lose their lives.
Don't let your life go. You can live a very normal life, and that's why we're also grateful to Samuel Dankwa and Abbott Infectious Diseases for this, initiative. But let's come to the self-testing. That's the crucial aspect of the conversation. It started in July. What exactly is this oral test? How is it done? What is this about? Tell us about it.
Good. So in July this year, the Minister of Health, Honorable Kwekwa Ajimamenu, actually launched the self-testing project here in Ghana. But prior to that, there had been pilots, interventions in some communities. But then when the thing was launched, we just upscaled it and we went nationwide. So there are two forms of the self-testing. We have the oral-based method, and then we have the blood-based method. With the oral, you only swab in your mouth. And
like with COVID.
Exactly.
Do the swab.
Exactly. Just do the swab and then can do the test. With the blood, that one you need to just, prick yourself a little and then you take some blood samples and you go through. We actually brought a video, if we can be shown, so that we demonstrate how the blood-borne tests actually happens. But so far, it's been very, very good. Initially, we were scared that Ghanaians will not accept it.
Patronize.
Yeah, but you'll be amazed. As I sit here, I'm overwhelmed with requests.
Okay,
our
what
school
are
is
people
doing
going
this
for more? Is it the oral one or the blood-based?
Okay, so the blood-based, as at the time we were launching the self-testing in July, our guidelines hadn't given approval to the blood-based.
Okay.
So it was the oral that was launched because those ones had gone through the process.
Right.
Yeah. But since then, we've had the guidelines giving approval for the blood based. So that's what we are now trying to also promote. We're not trying to promote the blood one. So far, the ones that are in the system are the oral one.
Okay.
And
so if the video is ready, I think this would be a good time to actually watch how it's done. All right, so we'll get that video in just a bit. We'll definitely play it before this segment ends. Okay, so now we're ready with the video, and we'll just watch and see how it's done. It's that simple. It is, in fact, that simple. But to explain even further, I have watched it and I understand, but I'll let Samuel Dankwa explain to us. So what did we just see?
Yes.
The process.
Okay, thank you so much. So simply put, this is called Check Now, as the name implies. It comes in a pack that contains a lancet, which is the needle, as we normally call it, and it has a buffer. The buffer is to just expedite the blood sample from flowing, and then you have the basin, and then the well, and then the kit itself, all included. So you just prick yourself, or first of all, you wash your hands carefully. Possibly we recommend warm water, just to allow free flow of blood in your hands, I mean. Now you prick your your ring finger,
okay,
or the middle finger,
okay,
where we assume that there's a lot of blood condensation, and you drop 2 blood into the basin.
So 2 drops of
2
blood.
drops of blood. Now, after you use the pipette to pick a portion,
so the pipette is that thing you use to draw the blood.
Exactly,
Okay.
yeah. With the pipette, you just drop the blood into the well where the test will be conducted. Now, clearly seen, so in the video, you could see, so this is the buffer. And then you drop a portion of the buffer as well into the blood sample. Exactly, which then moves the blood for the reading to be indicated. It takes 15 minutes, maximum 15 minutes. And then after you look for the indication, so you will have a C letter indicated on the test kit, and as well as a T, which means the test. Now the C must always show. If the C doesn't show, it means your test is not valid.
Okay.
So the C shows and then the T shows, it means that you are reactive. We don't say positive, we say you are reactive.
You are reactive.
Yes.
Okay.
Now, when the C shows and then there's no T, it means you are non-reactive.
Okay, so let's get this clear. Apart from the C and the T, what I saw, if you are reactive, 2 bars. If you are not reactive, 1 bar.
1 bar,
right?
correct.
Because some people will not be looking at all the C and T, they will just be looking at the bars.
The bars, correct.
Okay.
So now, when the T shows and the C doesn't show, it means your test is invalid. So I'll let Ernest explain further on that.
Okay. So thank you very much, Samuel. So basically, if you see 2 lines, one on the C and one on the T, it means you are reactive.
You are reactive.
We don't say positive.
Right.
We say you are.
The terminology is
reactive.
evolving. Right.
Yeah, and the reason is that, for Ghana, for us to be able to say that you are HIV positive, our algorithm says that you have to go through a 3 set of tests.
Okay.
So
I was about to ask that because sometimes, with the malaria testing,
exactly,
you can be sick, but you test and maybe the viral load is not a lot. So it's showing you are negative, but actually you haven't.
Yeah, exactly.
I was going to get to
that. So you have to go through a 3-test algorithm just so that we can be sure that when we say you are positive, you are indeed positive. Okay. So when you test and we see the 2 bars, we say you are reactive. Even if the second bar is faint, once there's a bar on the C and the T is reactive. Okay. So at that point, we recommend that you go to a health facility for a confirmatory test.
Okay.
So when you get to the health facility, then a confirmatory test will be done. Then we can be certain that whether you are positive or negative.
But initially, we say they are reactive.
Reactive.
All right.
Yes.
Atachi Selassie says, get tested. Christmas is coming. He has a bit of a point. Usually around this time, people do all kinds of things. Ensure that you're protecting yourself, and why not? Get tested.
Yeah.
Get tested. Get tested. Just to cap off the conversation. So 2 things. Where can we get this? The test kit and all of that. Is it widely available? Do people have to come to the commission and all that? And I know you have this health walk coming up. Yes. What is the significance of that? Very quickly.
So very quickly, I'm going to give you your T-shirts. You can see we are already.
Thank you very much.
We're already wearing.
We've been talking, promoting, testing, and all of that. Finally, I get.
Yeah. So finally, you get your T-shirts.
Thank you.
You need to wait and.
Let me see how it will.
Yes.
The producer on your world cry. It looks lovely on me, right?
Very, very lovely.
All right. Thank you so much for
this. Yes. So on
Saturday.
Right. That's tomorrow.
Yeah, tomorrow.
At Ayimensam, we are converging at various groups, hundreds of us at least, About 500, 600, 700 of us. So it's going to be a mammoth, kind of.
Wow.
Yes. And that's because we want to actually create more awareness about self-testing.
Okay.
Because we see it as a game changer. There are over 100,000 Ghanaians who have the virus but not aware.
Yeah.
And for us to be able to achieve the global objective of 95 target, we need to get more people to test. So we are encouraging people to test. So tomorrow, we are giving out free test kits.
Okay.
If you come around tomorrow, you get a free test kit. Now, starting from January, I know Abbott is making preparations to make sure that we can have these kits in various pharmacies, so you can just go and get one yourself. But for now, if you want one, they can contact you, and we can make some, some available to you. Or they can contact Garnet, and we can make some available to them. It's for free. It's for free.
You see, their humans are stretched. It's my stretch.
It's a stretch.
We'll talk about that later.
Let's meet there. Let's meet there.
Any final words, Samuel, since you've not, any final words?
I'll say we thank your platform for giving us this opportunity. And as Abbott, we are always ready to support in eradicating this HIV from Ghana. Thank you.
Right. Thank you so much, gentlemen, for coming and for doing this for God and country.
Yes.
Ernest Otson is President, Ghana HIV/AIDS Network, and Samuel Dankwa is Country Manager, Abbott Infectious Diseases. Now, coming up next, we're going to be talking about, well, the Roadmaster, a police motor transport and traffic directorate officer seeking to halt the rise in motor accidents. More on that right after the break.